Donald Trump has instructed his administration to halt funding of the World Health Organization. Trump says the WHO failed in its early response to the coronavirus. The U.S. president, who has himself come under fire for his handling of the pandemic, said the WHO should have done a better job of investigating initial reports in China. UN Secretary Antonio Guterres responded by saying that now was not the time to end support for the WHO. He said its work was absolutely critical to the global effort to combat COVID-19.
Trump says the roughly $400 million in annual donations will now be paused. The decision drew a sharp rebuke from the German foreign minister. Heiko Maas said in a tweet, "Blaming does not help. The virus knows no borders. We should work together closely against COVID-19. One of the best investments is to strengthen the UN, especially the underfunded WHO, for example, in the development and distribution of tests and vaccines." Bill Gates, too, called the move dangerous.
Well, former UK Prime Minister Gordon Brown has been calling for a stronger global response to the pandemic. And he joins us now from Fife in Scotland. Mr. Brown, thanks for being with us. What do you make of Donald Trump's decision to stop funding the World Health Organization?
Well, you know, on March the 26th, Donald Trump signed a communique that he was present at the meeting of the G20 when they said they would strengthen the WHO's mandate, they would increase the funding for disaster response, they would give more money so it could develop a new virus, and they would help it deal with the problems facing the developing countries. This is not only an illogical step by the president, it's an act of self-harm, because to protect ourselves locally in Germany or in America, we have to act globally. And if this disease has a second and third round in Africa or in the developing world, and then comes back to the West, then we'll be to blame for not helping those African countries that the WHO is intent on supporting protect themselves when they have underdeveloped health systems and poor social safety nets and can't adopt the social distancing and other measures that we're adopting in the West.
I want to talk about those African governments, those African countries in this pandemic in just a moment. But first, we've seen national governments leading the response to this pandemic so far. Have transnational organizations like the WHO or the UN failed?
I think each individual organization is trying its best. But, you know, when I had to deal with others with the global financial crisis in 2009, we were only able to say we will do whatever it can, which is what you've got to be able to say, when we brought everyone together. We brought the international organizations, the IMF and the World Bank and the UN and the WHO, but we'd also brought national leaders together in one forum, the G20. And what's missing at the moment is this concerted action together by world leaders. And even if America is reluctant to start with, and even if China is operating bilaterally, I think the European Union, Japan, the rest of Asia, Africa pushing us along, I think we could get this global coordination. And it's necessary, one, to finance the search for a cure and for a vaccine and for diagnostics and therapeutics. Secondly, to build capacity, because we're outbidding each other at the moment for limited capacity. We've got to build capacity in test kits and build it in ventilators and everything else. And thirdly, of course, to prevent this second and third round of disease, which has to be done by acting collectively.
Now, you recently helped pen an open letter to the G20. It was signed by more than 200 former world leaders and called for a coordinated global response to the coronavirus. Who do you think should lead that response?
I think we need two things. First of all, a pledging conference to deal with the financing of global health. And I do believe that the European Union has a major role to play in leading this, bringing in Japan, Canada, Korea, and then bringing in China and America. And I think, secondly, we need a G20 task force. We need this coordination on a week-to-week, day-to-day level. If we're going to get the world economy back to growth, then there will be a moment when we need to expand demand in the economy. At the moment, we're in employment protection. Soon we will have to restore demand, and that will require coordinated fiscal, monetary, and central bank policies. And it will also require the international institutions, the IMF and the World Bank, to be given by the politicians the power and the money that will enable them to support developing country economies.
G20 finance ministers are about to release their global action plan. As a former finance minister yourself, Chancellor of the Exchequer in the UK, do you think that plan should include debt relief for Africa?
Definitely. I've got an article in the Washington Post today with Larry Summers, which is saying 76 of the low-income countries in the world should get immediate debt relief for this year and for next year, not just for a few months, but they are spending more on debt interest payments at the moment than they are on their health systems. It is against our self-interest that they're not spending on health. We have got to help them do that. One of the quickest ways is debt relief. We will have to increase the special drawing rights of the IMF. We will have to give the World Bank and the IMF power to lend and to grant more money. All these things are going to be necessary, and it ought to be synchronized and brought together in one plan. And I hope on Friday, when the IMF and World Bank meet, that they will agree that a plan that includes debt relief is urgently required and has to be pushed forward.
Mr. Brown, thank you so much for talking with us. That was former UK Prime Minister Gordon Brown.
Thank you.